Frank Graewe. I'm a plastic and reconstructive surgeon, and I want to show you a little video that we made. Busy doing a thread treatment of almost the whole face, except the eyebrows. We did the cheeks, we did the jowl area, and neck area treatment. It is something that we get more and more requests for more non-surgical or minimal invasive procedures, especially for the face. And I must say, for facial procedures, facial rejuvenation, there is definitely a need for non-surgical procedures. Traditionally, facelift surgery has been the most performed procedure, together with eyelid surgery, which is still very important. Due to downtime, people are very busy. People prefer to have something done that hasn't got such a big downtime, that hasn't got drastic changes. Then minimal invasive or non-surgical procedures are ideal. I usually use a combination of lots of different treatments, because you can't do everything with one thing only or with one modality. So it doesn't make sense to just use threads, or to just use Botox, or to just use fillers. And you also have to look at your skin quality. You have to improve your skin quality. Sometimes you have to do something about fine wrinkling with peelings, with lasers. I use other modalities like energy devices to get some more skin tightening that's longer lasting, like radio frequency. Combine that with a little bit of liposuction, with eyelid surgery. And still there is definitely a place for facelift surgery, even for face and neck facelift surgery. But I want to show you this case of a lady that preferred to have non-surgical treatment, where we did quite a lot of areas. We did the cheeks, we did the jowl area, and the neck area. I want to show you the markings, the planning, then some of the steps during the intervention, and then a quick immediate before and after. And I think that will be quite interesting to see. I've talked a lot about threads before, and I think threads is a nice extra modality and armamentarium that we can use also to prevent injecting too much volume into the face. Instead of injecting volume all the time, we want to move tissue back where it's supposed to be. Most of the threads are resorbable, but there's also some non-resorbable threads. I prefer to use resorbable threads at this stage. For me, I've got control. You can do surgery afterwards without problems or complications. I think it's really a great addition. And I don't say that I don't use fillers anymore. I still use a lot of fillers, well proportioned in the areas where it's needed to give that extra sort of volume, or that extra strength in that area. I also use it together with Botox. That's what I want to show you today, a case where usually would say, let's do surgery, let's do a surgical procedure, and what we could achieve with just a thread treatment. Specifically in this case, there was no Botox, there was no fillers or anything else done in the same session. I just used a set of different threads. Those threads are made of lactic acid and caproic acid, and they have little barbs in it, which give the strength, and it basically elevates the tissue in the subcutaneous plane. It has little hooks, and then it hooks it up and it pulls it. The resorption time of these threads is anything between 1.5 and 2, sometimes up to 3 years. The newer threads have hyaluronic acid added to it to give a glow, or produce a glow to the skin, to rejuvenate the skin, to produce collagen induction. And the threads that I used for this specific patient were the ones without hyaluronic acid. Typically a thread treatment in one area consists of a set of threads. It can vary between 1, 2 threads up to 5 threads per side. And then you can do several areas, so you can end up using up to 10, 12, sometimes 15 threads. And I clean the area. I work in like a sterile field, like with a surgical procedure. And then I apply a little bit of local anesthesia in the area with some substance to constrict the blood vessels, so that you don't get too much bruising. Usually there's not a lot of bruising. There can be a little bit of swelling afterwards. There can be slight asymmetry for a few days. The procedures can take anything between half an hour, 45 minutes, and up to 1.5 hours if you do several sets of threads. and it can be done in the office, in a chair, much like Botox and filler treatments that we do, or little peelings. And downtime, as I say, is just a few days. Results are usually best after, I would say, after 6 weeks. And then it depends a lot on the skin quality and the specific patient, how long they last. I would say they last at least 6 months, but they can last longer.